This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to the latest edition of Mon Health Live. We're tracking COVID-19 and getting you the information you know about the pandemic that's going on. And obviously, the next step for most of us is going to be getting vaccinated. And that's what we're here to talk about today. David Goldberg is with us. Dr. Atkinson's taking the day off. But David, thanks for coming on again. We appreciate your time.
Good morning. Thanks for being here.
We also have with us Dr. Lee Smith. He's Executive Director of and Health Officer for Mon County Health Department. And Dr. Smith, thanks for coming on.
Good morning, and thanks for having me.
And also representing WVU Medicine, Todd Karpinski is with us, Chief Pharmacy Officer at WVU Medicine. Todd, thanks for coming on.
Good morning. Thanks for having me.
And again, this is a very unique and hopefully a very productive collaboration, David, between the two hospital entities and the county. And again, the goal is to get people vaccinated.
Absolutely. And what a banner week to have Albert Wright and myself on Hoppy's show earlier in the week, and now Todd and I today with Dr. Smith. We do collaborate together, and this is a great example of it. I want to remind all of our listeners, the health department in the county is responsible for mass vaccinations. The hospitals have been vaccinating our staff, vaccinating first responders. Now we phase into what I call second phase, which is getting more vaccines available, and we could do it together into this wonderful site that WVU Medicine stood up at the old Sears at Morgantown Mall. Great infrastructure, great layout, very easily accessible off of the interstate, coordinated and led through direction with Dr. Smith and criteria with the infrastructure for our two systems.
Mm-hmm. So, Dr. Smith, that's the idea, right? To coordinate efforts and to bring as many people as possible through one location.
Absolutely. What we have found is that most counties, including Monongalia County, where we're one of the larger health departments, we're just not able through the resources that we have immediately available to do the necessary vaccination to get large numbers done. And so we're extremely excited and pleased to be able to join forces with the two hospitals of this county, Mon Health System and WVU Hospitals, to bring the necessary resources together so that we can ramp up this vaccine effort and get large numbers done.
Mm-hmm. Todd, a couple of questions for you. First, one of the basics. What would you say to people that are reluctant to get this vaccine or may think that it's not safe? What would you say to the people that are apprehensive about getting the vaccine?
Yeah, I would certainly let the public know this vaccine has actually been in development for many, many years. And as we've seen in the clinical trials, the vaccine has been shown to be very safe. Speaking of the two vaccines from Pfizer and Moderna, as well as 95% effective following the second booster dose. We have been seeing here across WVU Medicine in our current vaccinations very low rates of adverse effects for our patients that are getting the vaccines. And that's been very promising, and that holds true to what we saw in the clinical trials.
Mm-hmm. What are some of the minor after effects or some of the minor symptoms that people may need to be prepared for when they get the first or second shot?
Yeah, what we're seeing for adverse effects is very similar to what we've seen to other vaccines, such as the flu. Maybe some sore arm, maybe a little bit of rash around the arm site, a bit of fatigue, maybe a headache. But we've seen very, very, very few significant reactions, and again, nothing that has surprised us as compared to when we give other vaccinations.
Mm-hmm. Yeah, and as many people know, I got my second vaccine, and I was tired the next day. I got a little bit of stiffening of the arm, and then the day after, I was fine and back to my normal self. So I couldn't be more supportive of Todd's comments.
Mm-hmm. Todd, West Virginia has among the highest rates, if not the highest rate of administration getting this vaccine to people. Now, the issue is the number of doses. First of all, what would you credit that the state is getting done they're getting this done better than anywhere else in the country.
Yeah, it's been very impressive what West Virginia has done, and I think it's been led from the state level from the beginning, and the governor and Dr. Marsh and others have really brought us all together to collaborate around getting vaccine out to as many West Virginians as quickly as we can. So I think that collaboration, and I think building the infrastructure early on with the National Guard, with hospitals, with local retail pharmacies, to have that in place so that when a vaccine was released, we were ready to go, we had clear direction, and we've had very good collaboration across the state from all of our players.
And this is for anybody. Explain to us how there can be, the last number I heard was 106% of the doses administered. How is that possible?
It's a tricky thing. So what we noticed very early on, and others across the state noticed with both vaccines, is that very typical with any medication coming from a vial, manufacturers put overfill in that vial. And we noticed within probably the first hour that we were able to get an extra dose out of those vaccines. Most of the time. Now, we weren't allowed to use that dose until the CDC, the FDA, our state, all weighed in and said, yes, it is safe to use the 6th vaccine dose from Pfizer. It's safe to use that 11th dose from Moderna. That's why you're seeing that percentage above 100%, because we're able to get up more doses than we thought originally.
Okay, David, let's discuss the vaccination center, and it's the facility at the old Mountaineer Mall. Everybody knows where that is, but why that location and why this collaboration?
Well, I think many people know a little over a week ago, WVU Medicine announced that they had space there for a distribution center, that they were able to convert it very quickly into a vaccination center. And then reaching out to Dr. Smith and the county, our county commission, and us, is let's use the site, bring our resources together, and here we are today being able to do it. And I think it's a testament to, both WVU Medicine and Mon Health may compete in the healthcare space, but when it comes to our community, we don't compete about the ability to be able to serve those who need us fast and furiously, like here during the pandemic.
Mm-hmm. Dr. Smith, anything to add about this facility?
Well, it certainly has a lot of space and parking. We have been doing some vaccination at other sites in the county, and sometimes it can be a little cumbersome with having enough space for everyone to park, and this answers that question. It's roomy on the inside. People can keep 6 feet away, and we can maintain those safety parameters that are so important when we have people gathering in space. And so I've been there and been around in it. Think it's a wonderful site, and think that this is going to be the answer for us to put all of our resources in one place.
And it is up and running, right?
It is. And actually, the health department had some extra vaccines to be able to distribute. And into the weekend and into Monday, they were able to do almost 1,000 a day to be able to take the supply we had through the health department. They ran the armory. This location was going, and we'll be ramping it up and consolidating over the next week or so.
Okay, and this is very important. There's a new way to register, correct?
Yeah, so the one website we want everyone to use is vaccinate.wv.gov. Anybody who entered on the previous website, which was wvumedicine.org-vaccine, we will take all of your entries, consolidate it into this website. The vaccine.wv.gov is the state site, so everybody gets on it, enters, and we'll be able to coordinate your scheduling through that website and report up to the federal government the requirements to make sure those vaccinated are taken care of and accounted for.
Okay, so that's the only place to go to now.
It is.
Okay, vaccinate.wv.gov. Anything else to add there, guys?
Well, this is Lee Smith. I would like to say that I look forward to people getting registered at this website because it gives the state leadership an idea of how many people are looking forward to getting vaccinated, and then that can get pushed up to the federal level where we can ask for additional resources to come our way. Right now we're in what's called steady state, that each county is getting a number of doses each week, but we want to go way beyond that so that we can become a regional place for people to get vaccinated.
Where do we stand, Dr. Smith, in terms of everyone knows healthcare workers got the top priority, and then I assume first responders, police officers, education, we're going through the schools and trying to vaccinate teachers and school personnel. Where do we stand in terms of that list of priorities?
Sure, that's a great question. And it is a little confusing because we started with this phased rollout. There would be 1A and B, et cetera. And as we started through that, the pandemic leadership at the state made the observation that we are still having way too many deaths occurring in this state, and therefore resources were pivoted to, at first, the over 80, then it was the over 70, and now it's individuals above the age of 65. And so the vaccine resources are going to this group at this moment in time. We have not forgotten the other people, whether it's the continuation of government or trying to get anybody who didn't make the first go-round for, first responders or hospital or what have you. Those doses will be made available in the future, but right now the state leadership is focusing on the above 65 group.
Okay. And if I may add, many of you should remember that the governor made the wise choice of prioritizing our nursing homes
Yes.
and all of the staff in our nursing homes. Well, that matches what Dr. Smith said about that age group and the vulnerable group.
Okay, so all residents and all staff members of nursing homes in the state are vaccinated. Is that a true statement?
Yes.
Okay. And Dr. Smith, as you point out, the preference or it's gone to 65 and older. That's what you're focusing on right now.
That is correct.
Okay, very good. Guys, we'll take a break. Stay with us. This is Mon Health Live for this Saturday morning. We're joined by David Goldberg, Chief Executive Officer of Mon Health Systems, and also Dr. Lee Smith, Executive Director and Health Officer for Mon County Health Department, and Todd Karpinski is representing WVU Medicine as well, the Chief Pharmacy Officer. We'll take a break. More to come. Stay with us. We'll continue after this.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
Dr. Atkinson taking this Saturday morning off. David Goldberg is with us on Mon Health Live. We're also joined by Dr. Lee Smith, Executive Director and Health Officer for Mon County Health Department, and Todd Karpinski, Chief Pharmacy Officer at WVU Medicine. And we're talking about the collaborative effort, one location to get residents of Monongalia County vaccinated, and that location is the Mountaineer Mall. You'll hear more about it. We talked about how to register, and there's one place to go now. It's the website vaccinate.wv.gov. So go to that site, get registered, and hopefully very, very soon, if you haven't been vaccinated, you'll get at least the first dose of the vaccine. Dr. Smith, what's the plan here to continue this rollout? What's the plan to make sure all West Virginians and specifically all residents of Monongalia County get this vaccination?
Sure. So as we were just talking, right now the focus is on 65 and older. And as we get a greater percentage of those individuals vaccinated, then other vaccine will become available. We still have the phased response that needs to be completed, which was phase 1, and it was broken into several A, B, C, D, E, and we need to get that part done. As you may recall, we were not originally going to be doing the general population until March when phase 2 began. So we still have lots of people that need vaccinated. Unfortunately, the state of West Virginia is only receiving 26,000 vaccine doses a week from the federal government. And so demonstrating our ability to do larger volumes gives the state the ability to speak to the feds about, well, we're leading the nation in the ability to get vaccine in arms, and we can do more.
Mm-hmm.
And, we'll take, whatever you can send us. And so we need to be able to demonstrate this ability clearly and consistently so that we can begin to get the additional vaccines.
And David, that's the issue right now. West Virginia, I believe, was promised, or that was the allotment was going to be 100,000. We're getting 1/4 of that amount. Do you see that improving? How will that improve the number of doses that become available?
I think what you're seeing now with President Biden's administration is using the Defense Act to be able to expedite more distribution, not only of syringes, but also vaccines. I heard this week Scott Gottlieb, the former FDA commissioner, commenting that the Johnson & Johnson vaccine is working its way through, and if we can get that, which is a one-shot vaccine, we'll be able to get to about 75 to 80 million people within the first 100 days of the year. So there's a lot of things in play. We ask everyone to emphasize vaccinate.wv.gov, get on the website, and as you are eligible, we will contact you to get vaccinated. Anyone who's entered onto previous sites will be consolidated with their prioritization into that centralized site, and that our location will prioritize Mon County residents, but other West Virginia residents registered in the site will be able to be seen there and vaccinated.
Okay. Todd, anything to add there, the number of doses that are available?
No, as the state continues to get allocations from the federal government, we'll do our best to get those in arms as soon as we can. I believe, has been mentioned, the infrastructure we have set up and through our partnerships, we should continue to be able to do that at a very rapid pace.
Mm-hmm. Is there any concern at all about the people? Obviously, with the Moderna and the Pfizer vaccines, it's a two-step process. It's a two-dose process. Is there any concern about people that have received dose 1 that dose 2 will be there waiting for them?
No concern whatsoever. We've been guaranteed by the federal government from day one that all second or booster doses will be available. And as we've seen throughout the last 7 to 8 weeks, those doses have shown up on time, and everyone that does get a first dose will be guaranteed a second dose.
Okay. Dr. Smith, let's talk through the process of someone who maybe they're a little bit older, someone who is registered, they get the call, they say, come get your vaccine. What will that process look like?
Well, as you mentioned, they would get a phone call, and this has been one of the pinch points, if you will. Many people in the above 65 age group sometimes have call blocking on their phone. And from personal experience, when we have called people from the health department, and I know the hospitals have experienced the same thing, is that people don't answer their phone. So we have tried to encourage people that if you sign up to get a vaccine, please be aware that you will be receiving communication in the form of a phone call, and we want people to answer their phones. And so we need to get that. If a person happens to get skipped, they weren't home, they didn't answer the phone, what have you, their name does not get eliminated. It stays on the roster, and the next time that a call-out goes, then their number gets called again until they answer. And so now that we have a centralized site, they would get a time to show up at the Sears Center for their vaccine.
Mm-hmm. All right, that's very important because I got into that habit of not answering the phone unless I know exactly who it is that's calling. So that's something that we got to break. That's something that we've got to get out of the habit of. Answer your phone. Answer your phone.
Absolutely, and I think that you're going to be getting calls from the health department. If you're on the legacy system, you're going to get a call from WVU Medicine. The partnership is so important that we can get to our patients, get to our community with one single voice, one single process, so we can get as many vaccinated as timely as possible.
Mm-hmm. And you're to be commended for that. The two entities and the county as well, all working together. We've got a couple minutes left in the show, and we hope we've answered the questions of people out there wondering what the process will be. We encourage you, go to that website, vaccinate.wv.gov, and again, answer your phone. If you see a call coming, you may not recognize the number, but it may be the call that you've been waiting for. Come get your vaccine. Again, a couple minutes left. David, what's the latest information that you can give us in terms of hospital capacity and the numbers we've been seeing lately?
Yeah, we are starting to see hospitalizations trend down. The patients who are presenting are a little less sick. Our ICUs are far from full. Our ventilator use has come down. So I think the more people get vaccinated, the more people keep masking, socially distance, wash your hands, follow the procedures and protocols. We're starting to see the curve bend. You got to do your part as we're getting ready to vaccinate you.
And Todd, same situation at WVU Medicine?
Yeah, we're starting to see this very same thing, which has been a very positive turn. One thing David mentioned there, and I want to make sure it's clear to the listeners, that just because you've gotten your second dose of vaccine and you're 14 days out, we still want everyone to practice social distancing, practice your masking, do all the things you've been doing. We are starting to see a light at the end of the tunnel with vaccination, but we're certainly not there yet, so continue to do all those great things that you've been doing.
All right, exactly 1 minute left. David, final thoughts?
No, we can't thank WVU Medicine, Dr. Smith, Sean Sikora, and the County Commission enough for your leadership and the ability to collaborate to help our community.
Dr. Smith, anything else?
I just wanted to make one point that the CDC has changed their recommendations for Pfizer and Moderna, that it is not, you don't have to set the alarm that it's 21 days on the nose or 28 days on the nose. It is now 4 days before 21 or 28 days and up to 42 days after. And
Okay.
so that's a change and should relieve some people's concerns that they didn't, get it right on the exact day.
Okay, very good. That's very useful as well. Gentlemen, great information. We appreciate the time today.
Thank you very much.
Thank you very much.
All right, Todd Karpinski with us, Chief Pharmacy Officer at WVU Medicine, Dr. Lee Smith, Executive Director and Health Officer for Mon County Health, and, of course, David Goldberg from Mon Health Systems. Thanks for coming in.
Thank you.
That'll do it. Another good show. More information next week on Mon Health Live, 104.5 FM, 1440 AM, WAJR.